It's 5 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. That should start momentarily. We'll hear about the latest figures and recommendations from the government on the coronavirus. In the meantime, we do know that South Korea has reported 27 new cases of the coronavirus, the first time in 5 days it's had fewer than 30. Of the new cases, 15 of them were transmitted locally. That brings the total number of cases in the country to 11,468, and with one more death, the death toll is now 270. The Central Disease Control Headquarters attributed the slowdown in new cases to its tracing of infections linked to a logistics center in the city of Bucheon, which it says is nearly complete. The health authorities remain on high alert because of the risk of another wave now with schools reopening. And we are waiting for the South Korean health authorities to begin their briefing any moment now. But in the meantime, Moderna, the U.S. pharmaceutical company, has announced that it has entered phase 2 of vaccine clinical trials for COVID-19. This second stage of the vaccine trials intends to enroll 600 patients. The first group have already been given the vaccine candidate. Earlier this month, Moderna released positive results for that phase of the study, showing that the participants did develop antibodies against the virus. There are currently around 10 vaccines for COVID-19 that are going through clinical tests on humans. Now, the briefing should be beginning right now. Let's cut over.
It is May 31st, and as of midnight, there have been 27 additional confirmed cases. And including the Bucheon Logistics Center, there were 15 cases of community spread and 12 were imported cases. And until midnight of May 31st, there have been a total of 11,468 confirmed cases. And as of now, 793 people are still being treated. And this is the result of carrying out more than 910,000 tests. Yesterday, one person passed away, and until now, there have been 270 cases of death. To the deceased and to the family members, we pay our respect and condolences. Today, we held a meeting under the leadership of the Prime Minister, and we talked about the status and countermeasures for the outbreak in the metropolitan area. And we also talked about the measures to monitor the logistics center. And we also talked about the core guidelines in terms of prevention and disease control. So we looked over and evaluated the status over the past 2 weeks so that we can come up with countermeasures. Until May 17th and 30th, when we look at the past 2 weeks, the serial infection that started from the Taiwan Club is still spreading. And there were also other scattered cases, such as the Bucheon Logistics Center and other cases. On a daily average, we are seeing 29.8 confirmed cases, and this is an increase compared to the 2 weeks previous. However, it is still maintaining the level to be under 50, which is at a controllable level. There are 793 people still being treated, and in terms of the hospital beds and the medical facilities, it is at a stable level. However, as we still see community spread, we see the confirmed cases of unknown causes, which has risen to around 7.4%. And we see that those people who are under control is within 80%. However, over the past 2 weeks, we saw that the level of risk in terms of the overall sense is rising. However, it is still at a level that can be borne by our medical facilities. So as to the quarantine in our daily lives, it is not at a level that we have to adjust. However, focusing on the metropolitan area, we see an increase in newly confirmed cases, and we are also seeing scattered cases of unknown causes. So it is at a serious situation that we have to take. For the Bucheon Logistics Center, as of midnight of May 31st, there were 111 related cases. We carried out contact tracing very rapidly, and we see that there is a slowdown in additional newly confirmed cases. However, we see that this is leading to community spread. And Itaewon club-related cases has spread to other multi-use facilities such as the singing rooms and the restaurants, and this is still ongoing. And also in various areas of the metropolitan areas, we are seeing scattered cases in places such as nursing homes and other missionary facilities. We are carrying out a rapid contact tracing. However, because the speed of spread is very quick, it is difficult to do it at a level that we can catch up to. For the metropolitan area, for the next 1 to 2 weeks, it will be very important for us to block and prevent other causes. Otherwise, we would have some damages to our daily lives and also to our students carrying on their studies. And also, to the next level, we have decided and announced to strengthen social distancing, except for going back to school. We're going to stop the operation of the entertainment facilities, and also we have administered the banning of gatherings for the facilities that have a lot of people, because the speed of containment is really important in containing the spread. So we ask our citizens to refrain from having gatherings and also refrain from visiting multi-use facilities such as restaurants. And we also ask the employers and business sites to make sure to adhere to the disease control guidelines very thoroughly. So you have to remember that we can actually get infected with COVID-19 at any time, at anywhere. So please make sure to follow the guidelines thoroughly. So the government will make sure to take countermeasures and monitor the logistics center. So government together with local governments will do an investigation on the logistics center, and until yesterday we have completed the investigation for 23 of them. We have done monitoring and investigation for key areas such as commuting buses, and for 25 cases we have asked to make improvements. And for some of the business sites, we will be actually requesting the HQ to make some guidelines on their own. The government will continue to monitor the shipment facilities and others, and this will include around 4,000 facilities. And also as well, the government will make sure to strengthen the preventive measures for business sites. So this will include call centers and IT industries. And for 1,750 of these facilities, we will carry out self-monitoring. In particular, if there are sites that are not adhering to the guidelines on the preventive measures, we are going to carry out ad hoc and random monitoring. And also, we're going to have the professional facilities monitoring these. And also for foreign workers and workers without qualification, we will be doing a thorough management. So for the foreign workers, for those without qualifications, we're going to induce them to take tests, and we're going to give a notice so that they follow the guidelines. Next is the obligation for preventive measures in high-risk facilities. So the government has selected high-risk facilities and has come up with the guidelines so that we can enforce them on them. So we will evaluate them based on how confined it is, and etc. And these include around 8 types of facilities, such as those indoor bars and such. So for these high-risk facilities, considering its own characteristics, we are going to make sure that the business owners and operators follow the guidelines. So they will be obligated to follow them. So for the owner of the business, they will have to come up with an online and electronic directory, and the visitors will have to fill this out accurately. and the business owner and operator will actually carry out ventilation and sterilization on a regular basis, and the visitors will have to follow the guidelines such as wearing face masks. So this will be enforced starting on June 1st, and for those that violate, then they will be fined with the penalty of within 3 million won. And aside from this as well, heads of the local governments, depending on the situation, will come up with the measures for other facilities, and this will be parallelly followed until we actually relax it. And we are going to introduce QR code system in electronic directory. So starting on June 1st, for the multi-use facilities in Seoul and Incheon and other areas, we're going to do some piloting. So during the pilot process, if there are any issues, we're going to complement them. And starting from June 15th, we're going to make sure that electronic directory is used as mandatorily imposed. And also for other multi-use facilities, we're going to support them so that they can make use of it as well. So when filling out the electronic directory, we're going to make sure that personal information are protected thoroughly. So we're going to do it so that the visiting information and personal information are stored separately, and these will only combine when we actually need it for epidemiology research. And after 4 weeks, which is the period necessary for epidemiology research, we're going to make sure that it is automatically deleted. So we are trying to impose it so that we can get an accurate analysis, and we believe that we will be able to strengthen the protection of personal information as well. So filling out this electronic directory will be only temporarily maintained when the level is at a high level. And other than these facilities, for facilities that could have a high risk of infection, we're going to introduce these to them as well additionally later on. So it is the last day of May today. On January 20th, we have seen the first case of COVID-19 in Korea, and we weren't able to even feel the spring, and now we are entering the beginning of summer. So we have spent a long time together with COVID-19, and as it is getting hotter, we believe that the level of concentration and preventive measure is actually decreasing. A lot of people are not wearing face masks, and there is an increase in contact with others as people are being more crowded. So we ask our citizens not to be complacent and to think of ourselves, neighborhood, and the community. So we ask you to follow the guidelines so that we can protect ourselves and the community as well. So until now, we have had medical personnel and the volunteers and the relevant personnel actually make a lot of efforts despite the fact that we were carrying out our lives. So starting tomorrow, the daycare centers will be reopening, and starting on Wednesday, many students will be going back to school. So thanks to the efforts that we made on social distancing for a long term, we were able to have our students go back to school. However, as of now, we have to ensure that community spread does not spread to students or the areas that they study in. So we ask our citizens to make concerted efforts together with governments as you have done so until now. And if you continue to make the efforts, we believe that we will be able to have our students study in school and be able to play with their friends. Thank you.
That'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.